Good morning. It's the 7th of May. I'm still here. So, yeah, I'm still in New York. The company that I'm with does 21-day contracts. I was invited to stay over. The hospital that I've been working at, seemed happy to have me. I've made some nice connections there, some good friends, or some good people. I've enjoyed serving the people of the Bronx and New York City, so I decided to stick around. There seem to be plans to keep some presence here of travel nurses that are connected to my organization, apparently through a good part of the summer. I'm not sure if that plan will change. I don't know what form that plan will take, but I have been invited to stay here for quite a long time. I don't think I'm going to. I think that most likely I'm going to be home pretty soon. I miss my kids too much. I do have obligations to the organization that I've worked with for many years. I want to fulfill those obligations, and I want to be a good member of that team because I care about that organization, and I care about the people that I work with and for there. So that's that. So I will admit I'm struggling a little. I feel healthy. I feel good. We'll talk about some of the health stuff here in a second. But overall, I feel good. Except, man, this night shift thing, day after day, is wearing on a guy a little bit. As you can see, it's like I gave hair and makeup the day off today. I mean, I know I look good, but now that I'm a YouTube influencer, I feel kind of pressured to look dashing or something. So, that's hard when you're not getting a lot of sleep. I come home, I get usually into bed around 9 o'clock, which is about what it is right now. I get to bed around 9 a.m., 9:30, depending on what I have to do, like how many layers of skin I have to scrub off after being exposed to all of these things that I'm being exposed to. Sometimes it's as late as 10, and that's okay. I can still sleep till around 5 or so, maybe a little bit after, and still do okay. The only problem is I have this thing that I experienced years ago that's creeping back, where I work all night, I get home in the morning, I am super dead tired, I am half out of it. I hit the bed and I pass out, and I am pretty much in a coma until I wake up and I feel refreshed and wonderful. And I'm thinking, man, did I oversleep? What time is it? And I look at the clock, it's like 11:30 or noon, and I've only slept like 2.5, 3 hours, and I can't go back to sleep. This happened for a couple of days in a row now, so I just threw down some medication, a little Benadryl, a little stuff to hopefully help me sleep a little bit more soundly today. So if I start getting kind of bleary-eyed, that's probably what it is. So that's what's up with that. I got the window open because it's a beautiful morning out. So you probably hear a little construction or something going on out there. Hopefully you can hear me okay. So sleep's an issue. Trying to get back on schedule there because, sufficient sleep is super important to your immune system and your ability to function at a high level. And those are two things I need to do while I'm here. I got to be on point. I got to have that healthy immune system going. Which luckily it seems I do. I've been working on supplements. I've been doing, a lot of vitamins and, trying to eat right, trying to take care of myself. I've been trying to do that for months now. pretty much since the new year. Not long after New Year, we saw the news that this was coming, and the more I learned, the less happy I was with how I thought I might fare versus this virus. So I was like, man, I better get my shit together. Yeah, so guess, I talked a little bit about this on social media, but yeah, it turns out I guess I had the virus because I have antibody tested, and I've got a big old bucket load of antibodies, it seems, maybe. This testing comes with some disclaimers attached to it. So who knows what I am? But I feel relatively comfortable knowing that I have things in my blood that likely other people don't, which, they ain't going to hurt me, but maybe they will actually give me some help, which, hey, I'll take all the help I can get. So yeah, for me, I had been here for a couple of weeks. I was somewhere in the teens of April. I just felt worn down. I felt tired. I had aches. I had pains. All my big muscles hurt. And not just ached. I mean, I kind of hurt. But this is the kind of stuff that I've had with, when I just don't get enough sleep and I'm not feeling right. I'm not eating right. I got some autoimmune stuff kind of kicking my butt a little bit. I had some swelling. I felt kind of tight in my extremities, and so yeah, I felt like I just wasn't really taking good care of myself. So, I wasn't running any fevers. Didn't have a cough at all at that point. And then I think it was right around the 18th or so, I threw a little bit of a cough at around midnight-ish or so, I guess. I was like, wonder what that is. It didn't really have, it wasn't like really a super nagging, super nasty cough. Had a little bit of discomfort along with it, but once again, when you're wearing all this PPE and some of the masks that I was wearing, like my big full face rig, the big rig, when you have that on for a long time, you really have to kind of force air in and out. And I'm thinking, well, maybe it's just a little tight from forcing all that air in and out. I was wearing it a lot. And so, yeah, I didn't think too much of it. And the next day, I woke up somewhere around noon just to kind of use the restroom, and I felt a little chilled. Not an obvious, super icky feeling. Started watching my oxygen saturation, getting my vitals at work, not really running any temperatures that are out of the ordinary, no fevers. So started watching pretty closely, and it was like the next morning I woke up from a good night's sleep, and I was like, boom, I feel great. I felt really strong. I felt, like a lot of those aches and pains were gone. I felt open. I felt healthy. I was like, wow, that feels pretty good. That's kind of how I've been feeling of late with some of the changes and some of the good nutrition. So I was like, maybe if I feel this good, and maybe I didn't feel good before. Maybe I was sick. I don't know. So I kind of filed that away. And so when the antibody testing became available, I was intrigued. I was like, how long has it been since then? Yeah, it's been enough time. Let's get the test. Boom! Surprise. So this disease can be relatively silent. You can have symptoms that don't really mimic much of anything. No super distinct cough, no fevers at all. And I was probably infectious. I was always in PPE when I was around people. Not around anybody here, so constantly washing my hands, trying to cover my cough, trying to keep really high, operational security around all those things. So I feel pretty comfortable that I was not really providing, a lot of exposure to anybody at that time if I was infectious. So all of that's good. So that's kind of where that is. To me, that lends some fire to some of these things that we're talking about how to keep others safe, about what we need to do in order to try to protect as many people as we can. That has kind of crept into my social media presence here, and we've had some drama. It's been fun. My last video was pretty much just me kind of foaming at the mouth, slathering over this, I guess, a nurse practitioner who has apparently a history of taking some stances on stuff that, I guess she doesn't necessarily like vaccines. She has done her research, apparently. I'm not going to cast a lot of stones at that because I really haven't done my research, but her hair and makeup were on point. Beautiful. A really nice social media presence. Her stylist. So, good for her. I stand beside pretty much everything I said in that piece. The long and short of it was that she was the voice of a friend who was a frontliner here in New York City. And that friend had seen terrible things and murder, used the word murder, qualified, used that word very blatantly in the title of her post, in an inflammatory way to garner a lot of hits and a lot of attention. And she backpedaled on some of that stuff in the video, and she said, well, this is my friend, what she's seeing, and I believe her, and it probably doesn't happen everywhere, but oh yes, you can be sure that they're killing people. That's some bullshit. Once again, you're not here. Once again, if your friend feels that strongly about it, your friend needs to be making the video. If your friend does not feel comfortable with putting that information out there, your friend needs to get the hell out of New York City. Because they are basically, at that point, they are an accomplice to what she is accusing these people of doing. She is not a healthcare provider. If she feels these people are acting in such a way as to imperil the lives of others, you need to get the hell out of Dodge, because by being silent and by not doing something about it or standing up in that moment for your patient, you are the problem. I'm going to say that again. If you are not standing up for your patient in that moment and providing some pushback, providing some level of check, you are the problem. Period. So if you don't like it, if you can't do something about it, if you can't write down some notes and hand them off, if you can't use the system to voice your concerns, you're not doing the right thing. So I will say again that hey, congratulations on having at the center of your core the desire to do good things for patients. That's good. How you're going about it is shitty, wrong, counterproductive, and dangerous. So you are basically out and out accusing people who are doing pretty much the best they can of malfeasance and worse. And I can't abide that. So yeah, I'm going to stand beside all that stuff. You have a lot of friends. They're coming to me and they're telling me that I look like a serial killer. They're telling me that I think I'm a mean guy. Boy, I'm so hurt. How will I sleep? That's probably why I'm not sleeping. I'm just so shook up by the criticism that I'm getting from these people that It's really wounded my inner child. Um, Please be nice. I'm fragile. Yeah. So what is wrong in New York City? Well, guess what? Yeah, there's some shit that is wrong. I'm going to look at this on the bright side, though. Yeah, the New York City health system is old. It's kind of cool in some ways. It has a lot of history, and it has a history of being a center that has been a driver for change in some areas of medicine. And that's a good thing. But as soon as we start resting on our laurels and we, harken back to the good things we did in the 50s, the 60s, maybe even the 70s, and we're not talking about the things that we're doing here and now to address the needs of patients, the issues of patients, the issues of healthcare today, then we need to do better. And I think there are some things that New York City can do better. Some of these things I don't feel comfortable talking about, simply because some of these issues are technical issues. They are procedural issues. And I'm just not an expert enough on what is happening, even in the places where I'm laying hands on people, to give what I feel is a full and fair accounting of all of this stuff. I can tell you that I am personally trying to practice in the interest of my patients at the highest possible level. I am offering my opinions, my thoughts to the people around me, to other staff, to other nursing staff, to residents, to attendings, to hospital administrators, to ADNs, and I will continue to do so. I think that's the right thing to do. At the same time, we need to be careful of our own personal biases versus what are the things that are possibly invisible, and for good reason, to people who live here and work here every day. Let me back up and expand on both of those points. Personal bias. If you come from City A, which let's pick a city out of the hat. Let's say you're from Atlanta, Georgia, or you're from Columbus, Ohio, and let's just say Columbus. That's where I'm practicing from. And you have seen a lot of the stuff and a lot of the things that are done and are common in the Columbus, Ohio area. And if that's the only place that you've worked, the only place that you have really practiced, if the scope of your tenure as a professional is not years and years and years, and you haven't seen other stuff, everything you know is right here. It's right here in front of you. And anything that is outside of that, be it good, bad, indifferent, ugly, dangerous, is just something that's foreign to you. So some of these people have a natural bias because they're seeing the New York City health system through a lens that is just different. And that's not necessarily better or worse. I'm not saying that there are not things that could be changed here, because that bias exists for people here in New York City as well. They're working in a system that grew organically to where it is, and they are captive to that perspective. So there are some things that maybe we could offer them, and that I think that they would be wise to listen to and hear. And we need to present that information in a non-confrontational, non-threatening, professional way that presents them information that is accessible, that they can act on without feeling like they're attacked. Kind of goes back to this other video that we're talking about. That woman is obviously attacking the system. It's really hard to be open to change when somebody is accusing you of murder. It's really hard to be an open-minded, reasonable professional when somebody is getting up in your face saying, "You're killing them!" Wow. So yeah, we owe it to these folks who have been busting their ass in bad conditions and systems that have some flaws. And we need to give them this information and this feedback in a way that they can work with it. Because if what you say is that your desire is that the patients get the best quality care, have the best potential outcomes, best possible outcomes, and you're not trying to present that stuff in a way that is accessible, you're part of the problem. You're thinking about you and your ego and your need to be right and your need to be the expert, and you're not thinking about the best possible outcomes as soon as possible for that patient. So shame on you, asshole. Shame on you. Grow up. Look in the mirror and be big enough and brave enough to try to do these things in a way that are healthy, emotionally healthy, professionally healthy, and work at it from that direction. So there's that. So there are some real issues, and I'm not going to really touch on those. But there's some stuff out there. Interestingly enough, I guess there was another video. I had a lot of people point me to this video of a nurse, and I don't know. I think maybe this person might be working for the same organization that I'm working for. Don't know, can't tell. But this person, I just saw, some of the very early parts of a video that was very long. Probably going to be about as long as this one is because we're 22 minutes in. I think that video from this woman was around 30-ish. And she was sitting there in PPE up against a wall, and she was discussing a lot of information about a patient that she had some really strong opinions on right there in the moment. And it kind of made me feel like this person was having this discussion while on the clock. For me, that's a big no-no. My job is to kick ass and take names for the people who are paying my salary in those moments, and be there to serve my patients. That doesn't include firing up the social media generator and blasting my thoughts and my feelings out there into the ether. Not time for that. In addition, the other thing I noticed, the person said that they were at one hospital one day and they had an issue, and then they went to a second hospital and they had the same issue all again, or a similar issue. So this person inferred that there were racial biases along with some of this. Drink break. That there was racial issues as to who was suffering, which of course is kind of an inflammatory thing, but we can talk about that. But we'll come back to that in a second. I think that we have to be very careful as healthcare professionals about how we address some of these issues and how we deal with them. I have not seen in any way, shape, or form any issue with either of the couple of hospitals that I've been at, or reports that I've heard from other individuals who are scattered at pretty much every hospital in this region, that would infer that the structure of what is happening is intentionally targeting people based on race for the quality of their care. So I'll say that if I did can pretty much rest assured I'd flip tables over that shit in real time. I can tell you that I think that there are systemic issues in our society that are impacting every healthcare system in America that are issues of race and class and power. And the bottom line is that the most marginalized, the most non-white, the poorest, the least represented are the most at risk. And this should not be a surprise to anybody if you're paying any attention to anything. The people with the least power always have the shortest end of the stick. They have the fewest options. They have the fewest resources. Every time anything happens, their margin for being able to deal with any crisis is exceptionally small. Something as bad as a rainy day can kill people who are super marginalized and super poor and super at risk. It does it. The more resources you have, the better off you are, the richer you are. Guess what? Who gives a shit if it's too hot? Turn the air conditioning on. Who gives a shit if it's too wet? Just go stay at your other house. Who gives a shit? So yeah, there are issues of race and power and class going on here. It's not that somebody is saying, I don't like you because of the color of your skin or of your orientation or your status. It's we just don't give a shit about people in general. We just don't. And we see that all over society. Had a conversation with a strong young nurse the other night who was talking about her experiences as an EMT paramedic here in the New York City area. And we were talking about some of the fast food people and how I respect the fact they're cooking my lunch. God bless you, thank you. And how I feel that those people deserve some recognition too. And that person was, at first, they were kind of offended by that. Because their feeling is that, damn it, as an EMT paramedic, she didn't make that good of money. Why in the hell should these people make money that was equal to or better than what she made? And I pointed out that the problem there wasn't the fact that they make too much. The problem was that she made too little. And you can see a little light go on for her. She's like, yeah, you're right. I guess I maybe was getting kind of screwed. Yeah, you were getting screwed, sister. People are still getting screwed. People who are essential employees are not really super valued. We see this as people are going back to work. People are being mandated. There are rules under consideration. There are changes to tired's kicking in. Changes to policies that if your employer says you can't wear a mask while you work because you are not going to be accessible to our shoppers or the people who are trying to use our services, and they can dictate that, and you can't say much. So there are people who, if they decide to not work because they feel it's too dangerous, states are asking that they be reported so that way they cannot get access to other programs, other resources, and that's a problem too. So yeah, that's something we need to really be aware of, because I really think that much of this push to open is not about a push to try to ensure the safety, health, and welfare of our society as best we can. This is a push to generate business income for people who are the most well-off, the most affluent, have the most options, I think they're starting to feel the pinch. And they don't give a shit about you. They don't care. You're not in that club. Yeah, some of you are in that club watching this. God bless you. Hey, congratulations. You're in that club. But we need to change some shit. It's not right. We need to find a more equitable system that overall is safer, more secure, with lower risk for more people, and is in general more robust and allows... I'm getting yawny, getting tired. We just need a better system. And we have an opportunity here, because I see there's a lot of people who 6 months ago, I don't know if they would have embraced some of these ideas of social welfare and gearing towards systems that put an emphasis on collective individuality as opposed to just the individual and the whole rugged, pull yourself up by the bootstraps, you invent yourself mentality. They've gone from that to, we are a village because we all are connected. And we are. The things that happen to our neighbor happen to us. The things that affect the kid that lives down the street eventually will trickle over to us. If you sprinkle a whole bunch of cash on the billionaire class, we ain't going to see that. They're going to buy another yacht. They're going to buy a yacht for their yacht. That whole trickle-down thing from the 80s has been blown up so many times. It's not real. It's fanciful. It's made up. There's no trickle there. When we actually empower and provide for the working class, the working poor, those people who are marginalized, then we actually see real change. We see real improvements. We see good things. So we need to do more of that. I don't even feel bad about saying that. I think that it's become quite obvious. So we can talk more about that another time if y'all want, but we'll see. So what about the rest of what's happening right now? There's been a little bit of discussion about some of the numbers that are happening with COVID, and it looks like maybe this thing was out there and loose and burning, slowly smoldering in some of these areas that have blown up. John, back in December, and maybe even earlier, back into November. And if that's the case, guess what? That scares the crap out of me, because we're saying, oh yeah, New York blew up, New York really caught fire, New York had big problems. But no, we can be sure that there's no other problems to be had, because look, this hasn't happened in Philadelphia, this hasn't happened in Baltimore, Atlanta's not burning to the ground, LA is not really burning to the ground. Well, there are some social differences in some of these areas. There are some social similarities in some of these areas. But if New York had been smoldering since late November and didn't really blow up until March, that changes some math. It changes how we should be seeing this. I've used the analogy of making mac and cheese, that crappy stuff in a box, the powders, and if you've made that, and I'm guessing most of you have, you can sit there, you can watch that, and the water never boils, and the water doesn't do anything. Giant pain, you're just getting bored. You look away for 30 seconds, and you look back, and suddenly there's that horrible mac and cheese foam that's jumping all over your stovetop, making a mell of a mess. just looking nasty, smelling nasty, and you've got this great big huge problem. And it came out of nowhere. Well, it didn't come out of nowhere. It just didn't really show signs. And if you're not paying attention when you get those early signs, you're going to have a big problem. And I think that's where we're at with this. I think that, I don't think we could have necessarily seen some of the stuff that happened that gave us New York City. Sorry. Once again, there are some things there that that we can take from that, and we could say, there was this warning sign. Sure, we can do that, and we need to do that. It's a totally different discussion, though. But overall, I don't think New York City was necessarily avoidable, just because who really expected this to blow up this way? It was rare enough that it happened, and it's hard for me to point fingers. But now, seeing as we have more information, we have more insight, we have a longer timeline, a different timeline, I think that we need to be aware that there are now plausible, real storylines that would tell us that Philadelphia shouldn't have blown up yet, and Baltimore shouldn't have really caught fire and burned hard yet. And some of these urban areas that hold a lot of similarities between level of affluence, how much public transit, subway, bus use there is. There are some similarities out there with these cities, and they're not having every hospital bed in the city turned into a COVID ICU bed. And so people are saying, well, look, there's the proof. Right there it is. It's not going to be that bad. You guys are overreacting. And not so fast. I'm at a point right now where, for me, my bottom line is if somebody is telling you, I know for sure exactly what's going on, that person is almost entirely sure to be full of shit. I don't know if it's possible right now, given some of the good quality data and some of the good quality understanding. Oh God, I'm going to have to cut this short soon. Good quality information that makes this muddy, makes this dangerous. And I'm scared that if this thing catches fire and burns in many places at once, the suffering and the pain and the horror is going to be something that America can't handle, because we're a soft nation of pussies who we're so caught up in this divisive binary system of my team or your team that we can't look at this as a public health issue. We can't look at this as what is the best way to assure the best outcomes with the least suffering. We can't do that because we're so tied up in this terrible need to argue and bicker like kids that we just don't have the capacity. And I think that's why I'm thinking that we're not ready for this, that that we're kind of likely to be doomed here to suffer a lot. And I don't know if I see a way around that at this point. I hope I'm wrong. I really do. But it just feels like right now we're sitting in a pot, and the water, the temperature's being turned up, and the water is like under that mac and cheese. It's right now, it doesn't look that bad, but any time now it could just turn to foam and make a huge mess, and we're going to be, that's where we're going to be. and it's not a pretty thing to think about. I think I've given up trying to talk about the things that I've seen, the things that I've experienced here in New York with some people, just because they're so caught up in their own issues and perception as to what's going on that they're just not listening. They're not reachable, so I'm not going to try. I'm just going to tell them, yep, you're right. It's a whole Obama plot to make you get gay married to some space alien and get COVID and become a socialist or whatever it is you want to think it is. Sure, that's what it is. Own libs by, trying to not give this to your family member or somebody you love. I don't know. I'm going to wrap this up. I'm fried at this point. The sleepy mids are kicking in really hard. I'm 41 minutes into this, and I'm about ready to fall asleep on cam, which, I'm sure all the haters from that other video are going to be like, look, he's doing drugs. He's narcoleptic. He looks like a serial killer. Whatever. I don't give a single fuck what those people think. I don't really care. I'll see if I can talk to my stylist about getting some of this stuff cleaned up. We'll get the hair cleaned up a little bit. I'll see if I can have my makeup on point for the next video. Yeah, we're gonna bring the heat. So, love you guys. Take care. Be good to each other. Try to talk sense to the senseless. Try to be there for each other, because I fear this shit is about to get pretty real. I don't know how soon. I think it's going to be a while yet, maybe, before we see another big bloom somewhere. But I think we're going to start seeing a more steady, rolling bunch of crap here pretty soon. It just seems like there's too much stuff happening in too many places. So hopefully I'm wrong. I've been way too right about some of this shit so far, so I don't know. We'll see. I guess I will make another video at some point. Who knows? Probably will never do another 42, 43 minute video because this is kind of silly. But, I'm an influencer now, so consider yourself influenced. I'm going to get out of here. Take care, guys. Love you. Have a good day, and be well. So, that's it. Bye from New York City. Bye.